Welcome to TSD, a platform where we think, speak, and discuss. My name is Nyasha Sharon. So my last video was on February the 4th, which was World Cancer Day. And on that particular day, I submitted a petition to Parliament. In this petition, I made two specific requests. Firstly, I asked Parliament to use its oversight role to probe the cancer situation in Zimbabwe, and in particular, the constant breakdown of radiotherapy machines. At that time when I wrote the petition, none of the two radiotherapy machines in the public hospitals, that is Mpilo Hospital in Bulawayo and Parinyatwa Hospital in Harare, were working. And as I speak, the machines are still not working. So I asked Parliament to inquire of the relevant stakeholders, including the Ministry of Health, as to the particular situation and to what efforts were being made on the ground to resuscitate these machines and to ensure that there is a permanent solution to this issue, because radiotherapy is a treatment that needs to be finished. Once started, it needs to be finished. Otherwise, there's just more damage that is done to the patient than had they not started the treatment. And so that was just one of my requests, for Parliament to probe this situation, for Parliament to find out what it is that causes this constant breakdown, and why it is that there is hardly any technical expertise to repair these particular machines when they break down, such that we go for prolonged periods without a radiotherapy treatment for patients that may need or that may already be on this particular form of treatment. And mind you, these machines in the public hospitals, they are for the poorer members of society, for the patients that cannot afford to access the private machine, radiotherapy machine in the country. And then the second petition, petition which I made was for Parliament to start the process of enacting a cancer legislation in Zimbabwe. Why this is necessary is so that there is specific focus on this particular disease, which, as I've said in previous videos, is slowly becoming a pandemic in Zimbabwe. The scarcity of statistics even makes it worse, because we sit on our laurels and think that cancer is not such a threat to society, and yet you find that so many people, a sizable number of the population, are impacted and even directly affected by cancer. Many of the families in the country have known somebody that is succumbed to or is living with cancer as we speak. And you know what? Since submission of my petition, I've been waiting to hear from Parliament. I've been waiting, even if they were not to contact me directly, to find out, at what stage, hoping I would hear it maybe in the public fora, that there was, Parliament was using its oversight role to investigate this particular matter. I do not know. I do not know at this particular point where we stand. All I do know is that in terms of the rules which Parliament makes for itself, rules which Parliament is expected to abide, its members are expected to abide, it's stated that when a petitioner makes a petition, Parliament, or the responsible person in Parliament, is supposed to contact the petitioner and notify them that their petition has been received. And then within a particular stated period, which I think should be 26 days, they should then give feedback to the petitioner on the outcome of the investigative process. That is the rule, or part of the rules which Parliament makes for itself in responding to petitions. And petitions, by the way, are enabled, they are provided for in Section 149 of the Zimbabwean Constitution, the supreme law of the land. And so as I make this video today, there has been nothing whatsoever. I made a follow-up to Parliament using the email address which is given on their public fora, following up on the state of this particular petition, especially taking note of the emergency nature of the situation, where patients that have already started treatment are languishing, and there's retrogression in their treatment because they started treatment which was cut short, and they do not have any alternative, because for the majority of them, going to the public hospital in the first place is because they cannot afford to go to the private hospital that offers radiotherapy in Zimbabwe. And so then this got me thinking. I asked myself, is it worth it to continue with these videos? Is it worth it to continue with this cancer awareness, you know? And to be honest, I say to myself at some point, you know, I think I should just stop, because there is just no momentum. Nobody's taking it. I might as well just go about my own business and do my own thing and take care of my own health. But then I said, no. There are many people that do not even have the platform to speak, that do not even know the rights that are available to them, you know, that do not even know that when we put politicians into public office, they have a duty, they have a mandate to be accountable to the citizens who put them in those particular positions. And so this is what then spurred me to come today and do this video. And I said, no, we need to make those in public office accountable. You know, in 2001, the African heads of state, they signed the Abuja Declaration. And in that particular declaration, they pledged to allocate at least 15% of their total national budget towards health. And this is 21 years later. And you know what? Very little progress has been made. I think as we speak, less than 5 countries, African countries, have even managed to reach the 15% allocation of health in their national budget. And I ask myself, why? Why is this? And you know what? I think it's because the particular people in office are not being made accountable. They are not being made accountable on how taxpayers' money is spent. And they need to be made accountable. We are bleeding nations. We are bleeding a nation, even in Zimbabwe. You know, when we continue to talk about the scarcity of foreign currency and runaway inflation, and yet we have so many people, those that at least try to pool resources, that are going outside the country to get treatment outside the country. And yet we could easily allocate 15% minimum of our national budget into increasing and improving our health systems. And that particular foreign currency would be contained within the country. So we need to make these people accountable. They need to know that they are put into office to serve the people and not serve themselves. And this is something that I say to myself, you know what? I need to take a stand on this. I need to take a stand on this, because we cannot just sit and complain. We cannot just sit and suffer in silence when we have a people that we put into office to serve us as a nation. And so today, I come and I just make mention of a few things that I have just come across, you know, in my research. And these are things that, you know, may not be publicly available to us as a people, because unfortunately, even though we are a very literate nation as Zimbabweans, you know, we do not really want to expand ourselves into researching, into finding knowledge. And that is why it is so easy for these politicians to hide things from us. They're not necessarily hiding them, but they just know that we do not want to read between the fine lines. And so, you know, since the Abuja Declaration, Zimbabwe has averaged 7% of its national budget towards health. In 2020, that was when an increase was made, and I think it rose from 7% to about 10%. And then in 2021, which is the current budget, you know, the 2022 budget, which was made late in November 2021, the allocation was slightly increased to 12.9. And, you know, it was even stated, you know, at the time, you know, by the public officials, relevant public officials, you know, for the particular that are responsible for budgetary issues, you know, they actually made a claim, you know, that they'd allocated 14.9% of the total budget towards health. But because we do not read and we do not follow information, you know, we do not even know whether we're going north or south. But the truth is 12.7% is what was allocated. And well, we could be grateful that the margin of 4% was made. You know, it's a 4% increase. We could be grateful for that. But this is 21 years later. What is so difficult about reaching the 15% minimum threshold? What is so difficult about that? And so again, I say we need to make our government accountable. We need to make them accountable for the positions that we put them into. We need to make them accountable. We need to find out why it is that we can never reach the particular agreement, that heads of states signed for. Why is it that we can never reach this particular threshold? Time and again, we are told we've exceeded targets. Zimbabwe has exceeded targets and so on in revenue. And so why is it that we cannot even reach, the particular targets? And in my own belief, even this 12.7% that we may be ululating over and saying, oh, it's a marginal increase of 4%, I would like to think that were it not for COVID, we would not have such an increase in the allocation to health. Were it not for COVID, I do not think we would have such an increase. And so, yes, we might say, okay, well and good, we did get the increase, but I do not know if the increase was not necessitated by COVID. And then also, when we look at the particular allocation, what is allocated and what is actually spent are two different things. Do we ever interrogate that as a people to say, okay, this is what was allocated for the budget for this particular year? Towards the end of the year, how much has been spent? How much has actually been spent? And then for me, with a particular passion for cancer awareness and cancer issues, our cancer infrastructure, our diagnostic and treatment equipment, they are so dilapidated and in some cases non-existent. And so this is where I really have a passion for. And in looking at the budget, at the national budget, you find that in 2020, the allocation of that particular health portion of the budget, that allocation to health, what the portion that was allocated to non-communicable diseases, which include cancer. Cancer is just one of the non-communicable diseases. There's also diabetes, there's hypertension, and to name but a few. Of that total allocation, in 2020, 1.9% was allocated to NCDs, which are the non-communicable diseases. And then in this current budget, 2021 budget, that 1.9% was reduced to 0.3% of the allocation to NCDs. And it tells you something. It tells you something that no matter what our relevant politicians go up there and state on the podium, these particular diseases are just not a priority at national level. They are just not a priority for God knows whatever reasons. Cancer is just not a national priority. And so today I come with a bleeding heart. I come to you with a sore heart. And I say, I make a challenge unto you Zimbabweans. We need to make these people accountable. And right now what I'm just asking of you is that I know that many people, many Zimbabweans have had a loved one that is either succumbed to cancer or that is living with cancer. And what I'm asking you to do is to join the petition that I've put in the description to the link to this video. I'm asking you to join the petition and just write your name or your pseudonym stating that you've had a loved one, if you truly have had a loved one that has been affected by cancer, that is living with cancer, that has died of cancer. We want these politicians to see just how much cancer has and is ravaging our society. Maybe then and only then can they sit up and realize that they need to take action. They need to realize that people are not to be taken for granted, because it is the people that put these politicians into office. And so the people have a right to demand that politicians are made accountable. People have a right to demand that politicians are made accountable. So I'm also going to put other links, other sites, yes, other links in the description to this video. And I kindly ask you to take action as per the links. Thank you. Don't forget to like, share, and subscribe to this channel. And also, you can link up with me on my other social media handles. And until next time, let's continue to think, speak, and discuss. Thank you.